Everybody's really friendly.
The facilities in here were incredible.
It's the best you could hope for.
I owe it everything.
The National Spinal Injuries Centre in Buckinghamshire is the oldest and one of the largest spinal injuries centres in the world. From our base at Stoke Mandeville Hospital, we provide integrated lifelong support to our patients from the southeast of England, nationally and across the world.
Sir Ludwig Guttmann was asked to found the Spinal Injuries Centre in 1944, and it was started here at Stoke Mandeville Hospital. His philosophy was that he saw competitive sport as important to the rehabilitation of the patients. And so that has really been a strong legacy of his, and that sport has been integral in our rehabilitation here to this day.
We pride ourselves on our innovative approach to patient care and strive to be at the forefront of clinical intervention, research development and psychological care post-injury. Our approach of early admission, along with our dedicated and highly qualified staff, means that the centre is now internationally recognised by the Commission on Accreditation of Rehabilitation Facilities for our excellence in the care of adults and children with spinal cord injury.
The philosophy of the National Spinal Injuries Centre is for a very patient-centred care. So once people have arrived here following their spinal cord injury, they'll go through their rehabilitation, past the acute stage, and what's really important is that people are able to be prepared to live their life following their spinal injury, and being here is only really the beginning.
Clearly, having a spinal cord injury is a very traumatic experience, and nothing really prepares people for that. People's lives change suddenly overnight and they have to learn a lot of new skills, there's lots of challenges to be met. And what is special about the National Spinal Injuries Centre is that we've put together a programme of rehabilitation that helps people to manage the stress of spinal cord injury.
Here our patients are not ill, they are undergoing a rehabilitation process, relearning those skills that you and I take for granted, from as much as brushing their hair, cleaning their teeth, to getting in and out of a car.
Recognised as the birthplace of the Paralympic Games, Stoke Mandeville hosts an unrivalled number of specialist facilities and services. These include the only dedicated children's unit in Europe, therapy areas, 6 specialised wards, an aquatic therapy pool, and psychological services. The centre also has an extensive established adaptive sports programme.
The role of physio here in the National Spinal Injuries Centre is to maximise each patient's potential, whether that's their physical potential or being able to explore the life skills that they're going to need.
We use sport as an aid to their rehab, so the goals that patients would be doing in their physio sessions, we use sport to help them achieve those goals.
We have table tennis tournaments, we have bocce, which is like bowls, and all sorts of sports. So it's more the social side, the fitness side that I really enjoy.
Aquatic therapy, or sometimes called hydrotherapy, is one of the treatments that we use with all our patients here. We use it as a means to both strengthen, mobilise, reduce pain.
What makes this centre unique is that there's no other centres specifically for children and young people across the country. We all have the same goals for the children and for their families, and we work very closely together.
We're actively involved in research, particularly areas of psychological research here. It's a world leader in looking at coping and adjustment and how people manage spinal cord injuries.
So everyone's working as a team, multidisciplinary, so it's not just me as an OT working with a patient, but the physio, the case manager, the nurse, the doctor and the patient who meet to talk about what their progress is, what it is they want to achieve and how we can help them do that. And that's very much an ethos here, is to work together towards their goals.
We do a lot of education, as in we're teachers, we teach in the patient education room, and we teach the patients the importance of skin care, bladder management, bowel management, sexuality and fertility.
A big part of rehabilitation is learning about spinal cord injury, the patient education programme, because it's designed to give patients the knowledge that they need to go forward in life and manage their spinal cord injury.
Everyone's amazing. From the cleaners that you see every day to the nurses that you see every day. There's such a bond, you see the same people every day. All the staff are amazing.
To this day, the centre is continuing its founding philosophy of providing innovative and dedicated care to all patients. Through our care and support, our main priority is to ensure that all patients reach their full potential.
There's a real passion when you see the unit about how people feel about their work, and it's a real privilege to be here and be part of that journey for our patients.
I love working here because working with spinal cord injury is actually an amazing job when you're working with people who can achieve so much, who start with one of the most devastating injuries that can happen to people. And it's not all doom and gloom, there's so much that's about celebration and progress.
Care-wise, it's been brilliant, that everything's gone right so far, fingers crossed.
When I got here, I couldn't eat on my own, I couldn't push a chair, I hadn't been out of bed in 4 months. So to come to the National Spinal Unit, I owe it everything.
I love my job because it's very different. I never know from one day to the next what I'm going to be doing with the children.
What I love about my job is that I was a patient here 16 years ago, and now I've come full circle. So now I'm using my experience to help people get on with their own lives.
The only place that I want my daughter to receive care is here.
I'm so lucky and privileged to be for being here, for them to help me get my life back on track.